So we often take for granted that we do hand hygiene, with our training as healthcare workers. And it's really important at this really unprecedented time that we're washing our hands correctly. So we thought we'd teach you today what you need to do to have really good hand hygiene. Now, here in our bathroom at work, we do have a no-touch tap, so you don't necessarily have one of these at home or out and about, but it is really important to try and avoid touching the tap if you can. So starting with dry hands and no jewellery, try and limit the amount of jewellery, watches, everything that you're using at this time. Not touching the tap, we're going to wet our hands. Making sure they're completely wet, and if you can, turn the tap off at this time as well. So a couple of pumps of soap, and we're going to lather. Now it's really important that we're lathering for a good 20 to 30 seconds. So starting palms together, then we're going to do the backs of the hands, really important at the backs of the thumbs, and your fingertips and nail beds. So circling in the middle of your hand and into the wrists as well. You want a really, really good lather. Hands in between the fingertips as well. Now, there's all of the good songs around that you can sing while you're washing your hands or teaching your children how to wash their hands, but Happy Birthday is the best one. And then we're going to rinse them off. So again, trying not to touch the tap, lifting up and rinsing. Okay, and it is really important that we're drying our hands as well. Now, here at Gen Health, we have a two-piece policy because otherwise we will run out, but giving a really rough dry, making sure that you're getting all of that moisture and discarding. And there you have it, clean hands. It is really important if you're using a lot of alcohol rub throughout the day that every time that you're needing to wash your hands, try and actually do a physical hand wash with soap and water 2 to 3 times for every alcohol rub, because it is better, it's more hygienic to use soap and water than the alcohol rubs, and we do know that there's a bit of a shortage on alcohol rub as well. Other things to consider when you're looking at hand hygiene is touching your face. Try and avoid touching your face at all times, keeping your hair away from your face, glasses, all of that kind of thing, avoiding touching. Where possible, in and out of door handles, using your elbows as well. And classic, if you're sneezing into your elbow, staying home if you're feeling unwell. Good luck in this really unprecedented time, but we'll all get through this together.